Welcome to Chapter 1 in your Surg Tech Pharmacology course as we just introduce some history of pharmacology and some laws that are related to it, just starting that foundation. So our learning objectives, and these are good to use as your study guide. So if you look at these and kind of make an outline or note cards, whatever's best for you, again, kind of actively, if you're writing these out, even if you write them down and then as we go through the presentation, you kind of fill them in, kind of like you're taking notes in class. Just helps you to engage a little bit more in the material instead of just listening to the conversation. So we're going to be defining a few things, again, talking about the history, the World Health Organization, some of the laws that are related to drugs and surgery, talk about the DEA and FDA, difference between a policy and procedure, and how facilities use those, and then what happens if somebody is negligent related to pharmacology. So first of all, just the definitions. Pharmacology, you're probably familiar with this. So pharmacology is drugs, ology is study of, so pharmacology is just the study of the composition and properties and uses of drugs. Defining a drug, I want to caution you here, we are so inundated by the term drug as thinking about illegal drugs like heroin or cocaine, things like that. But again, this drug is a very generic term. We're not just talking about illegal or illicit drugs. We're talking about anything that is classified as a drug. And that definition we use is any substance that's used not only to treat, but also to diagnose, to cure, to mitigate, so just like kind of decreasing or preventing a disease or condition. So if somebody's being injected with a dye for like a PET scan looking for possible cancer, that dye is a drug. It is something that is being added to the body that's related to treating or diagnosing a disease or condition. So this is a huge category. So again, very broad. Don't just think drug and think about cocaine or something like that. And then people dealing with pharmacology. So we have pharmacologists and pharmacists. So a pharmacologist are kind of the research people. So they're working in a research setting. They have like a master's and PhD kind of doctoral work. So they have the knowledge of how the drug works, how to make the drug. They're not actually prescribing it, so they don't need a license or anything like that. A pharmacist, though, that's who's actually in the hospital or like a retail pharmacy. So they do have to be licensed in order they complete a pharmacy school. So their training is different than the research of a pharmacologist. So they are educated in how to make the drugs and also dispensing them. So being knowledgeable about how they work so they can interact with the public. So again, pharmacist has to be licensed. Pharmacologist is not. They're kind of the background development of the drugs. So some of the history of this. So, using drugs is that term that we just used, any substance that's trying to help alleviate or treat a condition. This has been around for a long time. So people, ancient introduction of people using medicine, so using animals or minerals, especially plants, for any kind of medicinal purposes. So again, this is not new science. A little bit newer, still a long time ago, but those Mesopotamians, they have some clay tablets that have been found that describe like apothecaries, which were kind of like pharmacies a long time ago. So actually people that were talking about signs and symptoms and how to prescribe or like what to use to treat those. And then the Chinese, and you may be familiar with this, but again, 2000 BC, so they began kind of the herbal medicines. So Chinese and herbal medicines really go kind of hand in hand. So more kind of those alternative drugs that we think about today. Then in ancient Egypt, there was a medical book that actually had 42 volumes. called the Medical Book of Thoth that talked more about healthy living, so things to do to live longer. And then Ebers Papyrus had formulas, remedies, and incantations for treating it. So again, a couple written documents about these that have been discovered. So again, going back very, very, thousands of years ago. So again, this is not a new science. Pedanius Dioscorides, so moving a little earlier, so 1 AD, actually termed the material of medicine using plants as drugs. Galen, so again, still a couple thousand years ago, actually created preparations though that are still actually being used today. So he was a philosopher, a physician, and a pharmacologist. So again, back then we didn't have just one thing. Lots of people, especially people that are historical that we think about, they had lots of different kind of terms based on their education and what was available to them. So getting a little closer, so in the Middle Ages, monks actually grew healing herbs. So again, we think about the Chinese with their herbs, but we also had monks that used these herbs and translated and distributed information about the drugs, so that pharmacological information. And the first independently owned apothecary shop was established in Baghdad in 8 AD. Then an Arabic document in about 900 AD detailed some of the drug preps, the storage, and also trade routes. So again, if we're thinking about before we had planes and all of that, trade routes were actually part of their documentation about drugs because it was where you could get these, especially plants or different things that were being created and distributed around the world. So trade routes were actually part of that pharmacology back then. So the first official pharmacopoeia, so we think about an encyclopedia, but just for drugs, was written in Italy in 1948. This had some of the legal standards for making and manufacturing drugs. Friedrich Wöhler, who was a German pharmacologist in the 1800s, he was the first one that made a synthetic drug. So we'll talk in later chapters, but synthetic is completely man-made. So it's made in a lab, not something found in nature. So he was the first one to create a drug. In this case, it was urea from inorganic materials. So it wasn't something that he was able to kind of manipulate from nature. He actually created it like in a test tube in a lab to create that urea to be used. Then in the mid-1800s, thinking more about surgeries now, so chloroform, ether, nitrous oxide, so anesthesias were starting to be developed in the mid-1800s. Also, formal education became a thing in 1847, and Oswald Schmeidenberg published what was called the Outline of Pharmacology. So again, just getting more and more publications that are still kind of set up our pharmacology today. Now moving into the 20th century, this was the development of drugs like vitamins and insulin, or antibiotics like penicillin, some of our sodium pentanol, which are more the psychotropic drugs, again, some more antibiotics, some anti-cancer drugs, some vaccines starting to be produced. So enhancement of surgical techniques, thinking about, whenever they first started doing surgeries, aseptic technique wasn't a thing. They didn't worry about using gloves or washing their hands or anything. So again, enhancements in those techniques, especially pain control methods. So drugs used for that pain control, managing bleeding during surgeries, and preventing and treating infection. Again, that aseptic technique and use of antibiotics. Now switching into some of the laws, policies, and procedures. So individual facility policies and procedures are based on the laws that are set up at the state and federal level. So they aren't just like, oh, I think we'll do this today. So it is based on the law in order to bring them in compliance. Always the stricter rule applies. So if there is a conflict between a state and federal law, so we're actually seeing this kind of counterintuitive here, but especially what we're seeing with marijuana, where it's becoming, legalized in some states, but at the federal level, it still isn't. So again, anytime a stricter rule is out there, that stricter rule should be applied. So again, if one says something about a procedure and the state says something else, the stricter is what should be followed. So it's important to know and follow these regulations that pertain to surgical practices. And especially, again, that's somebody's job at the hospital or facility that you're working at, to know what those are and to set up the procedures to keep everybody following and in compliance. So that international support is the World Health Organization. Now their goal is to kind of develop some type of standardized international guidelines. Now it's important to understand these are guidelines. The World Health Organization, commonly called WHO, has no jurisdiction. They have no authority. They can't arrest people. They can't penalize people. But they are a group of different people in healthcare across many nations, so again, international, that use all the information that they have from those countries to set up, again, guidelines that can be used by all countries regarding drug manufacturing, storage, distribution, and dispensing, because again, some drugs are legal in other countries, not in the US, so that information is gained, and then sometimes they become legal in the US based on research done in other countries. And again, procedures that are done in the US provide knowledge for others. So that World Health Organization helps provide those international guidelines. They published what's called the Guidelines for Safe Surgery in 2009. Again, no jurisdiction, can't arrest or penalize people, but again, provide those guidelines. So what are those guidelines? So what they say is there should be rapid recognition and response to adverse drug reactions. So if somebody has an allergic reaction or somebody's blood pressure spikes or drops after anesthesia, they kind of help guide those or say what should happen or things to look for. And they also recommend practices to avoid errors. So we'll talk in later chapters about verifying drugs, and it has to be verified 3 times before it's administered. So some of that is based on these guidelines. Administering prophylactic antibodies. So this is using antibiotics before surgery to help decrease the risk of infection. And so this contains reproducible checklists that can be used for surgeries. Now, what are some of the laws related to pharmacology? So the first one was actually back in the mid-1800s when we started to see, again, some more advancements like we just talked about. So the Drug Importation Act was the first one. And so this prevented adulterated drugs from foreign markets. So they couldn't, and we're seeing this more actually today, where you can, with online ordering. So this law actually prevented those imports of drugs from other countries. Then in the early 1900s, the Biologics Control Act. This ensured proper contamination prevention. So when these drugs were being developed, they weren't just mixing in things. There wasn't dirt. There wasn't, something that could make somebody sick from them. So that manufacturing was being more monitored. Then the Wiley Act, the Pure Food and Drug Act. This pertained to labeling medications. So it set some quality and purity standards. It also required inspection of manufacturing plants and shipments from foreign and domestic drugs. So this was the first law that really looked at making sure that drugs were safe. So we, first we couldn't import things and then some contamination. But this Wiley Act was the first time that things had to be labeled properly. That indicated like their ingredients that were in there had some quality standards, was this Wiley Act. Then the Shirley Amendment. This prevented manufacturers and merchants from making false claims. So if you've seen like some older movies, especially from like the early 1800s or like depicting that time, there were traveling salespeople who would just carry around these elixirs and things that cured everything, and they could just say whatever they wanted to. They could say, oh, this cures cancer, this cures migraines, without having any lick of, accreditation or proof of that. So the Shirley Amendment said that, manufacturers and merchants had to say what's happening. They couldn't make these false claims. Then, unfortunately, narcotics became an issue, especially morphine around this time. So this is close to like World War I. So 1914, the Harrison Narcotics Act. This required prescriptions to purchase narcotics. So again, before that, you could get elixirs with morphine in them. So again, this kind of required that prescription for these, not through these traveling salespeople. So it also regulated the import and sales as well as manufacturing of any narcotic, which were pain medications or anything thought to be addictive. Then in 1938, we have the Food, Drug, and Cosmetics Act. So this required that all the components be safe and approved by the newly established FDA. So the Food Drug Administration was set up by this in the early 1900s. And so they were tasked, this government agency was tasked with, having those safety protocols for manufacturers, following up with them and ensuring that drugs were actually helping, that they were safe before they could be prescribed. Then in 1941, we had the Insulin Amendment, and then 1944, the Penicillin Amendment. And both of these just required testing for potency, which is the lowest dose that can be used in order to be effective. So how much do you need to take, so that like the dosing was being monitored, and also the purity. Then skipping up to the 1970s, so the Comprehensive Drug Abuse Prevention and Control Act was established, and there's more regulations for those narcotics. And this is where we get the establishment of the classification. So like class 1 through 5. So class 1 narcotics, those are the most addictive. They don't have medical use. We'll go over those later. But this is where this is where the DEA was established, was from this act. Then we have the OBRA Act, and this is requiring pharmacists to offer counsel to patients receiving new prescriptions. So this is still in place. Whenever we get prescriptions, a lot of times it's now just whenever you're signing for them, it'll ask if you've been counseled or if you kind of waive that right. It's because of this amendment or this act that was put in place, saying that pharmacists had to tell you about their medications. So then we had the HIPAA in 1996, and this just ensures patients' rights to privacy, so that medical information that's being collected is not being shared. So now our roles of the DEA and FDA, which I kind of already mentioned, but again, DEA, that was from that Narcotics Act, so in 1973. So they're looking at controlled substances. So again, narcotics, these are things that are addictive based on those classifications. So the DEA is actually who puts the drugs in them. So again, marijuana is a lot of debate right now. It's class 1, but again, looking at maybe reclassifying that, but that federally is based by the DEA. The FDA established in 1930. And again, these are the ones that are looking, actually determining if drugs are safe and effective, if they can be used in the United States, inspecting those agencies or manufacturing companies, ensuring labeling and approving drugs for the market. State laws, not so many here after we had all those federal laws, but there's the Practice Act, and that just identifies the scope of a practice. So what can they or can they not do? So of course we can't be doing surgeries in just a regular office suite, but sometimes there are specific surgeries, especially like with dentists, where wisdom teeth can be extracted. But again, what they can and cannot do, what a practice is allowed to do, is based on state law. And this also, again, sets those limits. It defines the responsibilities of the practitioner. So what are they responsible for? What can they and can they not do within that practice? And then also the penalties for not following those rules is based at the state level. right, so then what's the difference between a policy and a procedure? So again, we have to comply with both the federal and state. If there's a difference, whichever one is the most strict is the one that should be followed. So based on that, based on all these laws, to make sure everybody's compliant, we have what are called policies. And these are written by the institution. So this is the plan or the rule that addresses those specific laws or need to be compliant. So this is how we are going to stay compliant with all the laws. That's the policy. Now the specific steps that allow that policy to be implemented are called the procedures. So these are the steps necessary to implement the policy. So if the policy is saying, you know, we need to ensure that our OR rooms are sterile, okay, that's the policy. Okay, how does that happen? Those are the procedures. How long does equipment have to be sterilized, or how does it become sterile? That's the procedure, those steps that are taken to ensure that ORs are sterile. Now, as far as a few things related to pharmacology and especially surgery, verbal orders are an accepted practice, especially in surgical environments, because it's not practical for someone to be like, oh, you know, right now this patient is bleeding out and I need a drug to coagulate, you know, I need an anticoagulant, coagulant to stop them from hemorrhaging, or I need more pain medicines. They're not going to go over to their, you know, to their tablet or whatever and put in a prescription. You know, they're just going to say, I need epinephrine, I need whatever is going on. And so they're verbally going to ask or request that. And it's, again, common and accepted practice for that. As long as you understand what they said, it's, you know, always good to double check before something is actually given. Some of the publications related to pharmacology, so we have the Physician's Desk Reference, the United States Pharmacopedia and National Formulary, which talks about how drugs are made, the National Drug Code Directory, American Hospital Formulary Services, the Medical Letter of Drugs and Therapeutics, the Joint Commission, and the National Patient Safety Goals. So all of these are different national publications that are going to be where information about drugs are found and how to prepare them in those protocols. Now, what happens if you are in violation? So that negligence, which is set at that state level. So if there's personal negligence, possibilities, you can be terminated. Again, and this depends on the severity and the outcome typically. So again, if somebody administers the wrong medication, what happens? So termination, loss of certification. So, you know, hopefully you're going to become a certified surgical tech. Again, depending on that certification can be removed, and even potential civil and criminal charges. So you could get arrested or have to pay fines based on those actions. And of course, the consequences to the patient for somebody being negligent is they may suffer mild to severe consequences up to, of course, death. So again, just making sure that everyone's staying in compliance, knowing those policies and procedures to keep everybody safe.